Maggie Henson, this is my persuasive speech, and this is my audience. "25 states have adult obesity rates over 30%, putting millions of people at increased risk for heart disease, cancer, and diabetes." This quote shows that obesity isn't just an eating disorder. It also has a major effect on our bodies and has the ability to cause multiple health effects. Throughout this speech, I will persuade you to live a healthier lifestyle to prevent obesity now and in the future. Obesity can be treated and prevented by taking more caution in the foods that we eat, by raising your children up in a healthy lifestyle, and by exercising. A major way that obesity can be prevented is taking caution in the food that we eat. In the Journal of Human Nutrition and Dietetics, it states dietary patterns, including the high consumption of energy-dense but nutrient-poor foods, have been reported as significant risk factors for both obesity and ID. This quote shows us how much of an impact our regular daily diet has on our health. Not only are the obesity rates high in adults, but they are also high in children. In a journal written by Campbell and Crawford, they state, "We review literature that shows that children's eating behaviors are influenced by the family food environment. These findings suggest that the family environment should be considered in developing obesity prevention strategy for children. Yet the current strategy focuses primarily on the school environment." In a study done on obesity, it states physical activity, particularly exercise training, remains to be a cornerstone of obesity interventions. This quote shows us that exercising is the main key to treatment of obesity. Children that are obese don't even have the chance to grow up living a healthy lifestyle if their parents don't pay attention to the food that they eat, as well as the proportion that they eat. Not only is obesity bad for your health, it also takes a part in your income. In an article written on science-based solutions on obesity it states, a recent study estimated annual medical spending as a result of overweight and obesity, with a BMI over 25, to be as much as $92.6 billion in 2002 dollars, 9.1% of U.S. health expenditures. This research shows that the amount of medical attention needed for treating or preventing obesity is an extensive amount, and I guarantee half of those people don't do the things that their doctors tell them to do, not because they don't want to, but because it has become a habit and a lifestyle to them. With all of that being said, I think it is obvious to realize that the problem that needs to be addressed is obesity in both adults and in children. Despite the attention of the health profession, the media, and the public, and mass educational campaigns about the benefits of healthier diets and increased physical activity, the prevalence of obesity in the United States has more than doubled over the past 4 decades. Obesity has a tremendous amount of effect on our lives. It can cause emotional distress, physical defects, and psychological disorders, such as being antisocial. Public health and clinical strategies to address the obesity epidemic must begin with weight maintenance for the adult population, weight loss for the obese, and increased physical activity for all. With that being said, the proper way to go about decreasing the obesity rates in adults is to go to a doctor, make a plan of a new lifestyle, and to have an accountability partner to make sure you follow the plan created. However, it is different for children. Children eat what they're given to eat, so the proper way for a decrease in childhood obesity is to feed them healthful related food such as the nutrients, minerals, and protein that they need in the correct proportions. Secondly, to bring to the legislation that the cafeteria food being served at schools need to be nutritional and provide the children with the nutrients that they need. I challenge you all to begin living a healthy lifestyle to prevent obesity not only now, but in the future as well. Thank you.